Hey everyone, and a very warm welcome to Afro Mosaic Health Guide magazine. We are so glad to have you with us. So we're on this incredible year-long exploration we're calling the Global Black Lifespan Journey, where we're looking at health across the diaspora. And today, our journey kicks off right here in London, starting at the very beginning of life, to really dig into the foundations of our health. So let's just pause for a second and ask a really big question, one that pretty much shapes this entire series. Where does a healthy life actually begin?
For us, the answer is crystal clear. It begins right here, with that incredible, profound journey of pregnancy and birth, and of course, those super critical weeks right after. This is the bedrock. It's the foundation that a whole lifetime of health is built on.
All right, so let's talk about the lifespan's first steps and why maternal outcomes are so foundational. You see, there's a really important reason we're starting our London focus right here with pregnancy and childbirth. It's literally the first step in the entire story of a life. And the mother's health? Well, it directly shapes the health of her child, her family, and believe it or not, even generations down the line.
Okay, now we need to get into the stark reality of it all and really understand the disparities in UK maternity care. Because here's the thing, that foundational first step, it's just not the same for everyone. And we have to face a pretty tough reality. The journey to motherhood here in the UK comes with unequal risks, and for Black women, those risks are, well, they're tragically significantly higher.
So let's just look at the numbers for a second. This comes from the latest MBR ACU UK report. That stands for Mothers and Babies, Reducing Risk Through Audits and Confidential Inquiries. So, between 2021 and 2023, the overall maternal death rate in the UK was about 13 deaths for every 100,000 births. But here's the thing you really need to hear. That single number hides a much bigger, much more disturbing story. Because for Black women, that rate is almost 4 times higher. That gap? That's exactly what we're here to understand today.
And this isn't some random chance. The Royal College of Obstetricians and Gynecologists, the RCOG, they put it in black and white. They say that ethnic minority women experience poor care. And this can be care that's shaped by racial stereotypes, and this is so important. It includes women simply not being listened to when they talk about pain or their own concerns.
And this isn't just theory. Look at this case story from that same MBRACE report. It's heartbreaking. A mother, she reported having shoulder pain after she gave birth. There was no further investigation, and less than 2 weeks later, she was found dead at home from a coronary artery thrombosis, a blood clot. This is the real-world devastating cost of not being heard. This is literally what's at stake.
So the big question is, how on earth does something like that happen? To really get it, we've got to look inside the system, at the pressures behind the problem. This isn't about pointing fingers at individuals. It's about trying to understand the whole environment, the system itself, where these kinds of tragedies are even possible. Okay, so the RCOG points to a few major systemic issues. For one, racial stereotypes held by healthcare professionals can absolutely change the kind of care a person gets. Then, there's the fact that Black women are seriously underrepresented in the clinical studies that all of our medical knowledge is based on. What does that mean? It means the medical guidelines might be less relevant for darker skin tones, and staff can be less confident recognizing symptoms. You put all that together and you've got a system with some really dangerous blind spots.
Now let's take a look inside the NHS at the pressures they're under. You layer all those racial factors with the immense stress the whole system is facing. You can look at public board papers from pretty much any NHS trust and see the same story. Consultant vacancies, a heavy reliance on temp staff, massive financial pressures. You've got fragile services just trying to keep their heads above water. And when a system is stretched that thin, any pre-existing biases, well, they can get amplified in a really dangerous way.
Of course, this journey into motherhood isn't just a physical one. It's deeply mental and emotional too. So, what about mental well-being in all of this? And this is where we see a really troubling gap between what should happen and what can happen. On one hand, what should happen is that there are clear, easy-to-follow pathways into specialist care, that services have the space and staff to see every woman who needs them. But the reality? That MBRACE report shows that referrals can get declined. If a woman disengages, nobody really follows up properly, and sometimes patients are sent home way too early before they're fully treated.
And the consequences, they're just catastrophic. I mean, listen to this story. Again, from that same report. A mother who had known mental health issues had a referral to the perinatal mental health team declined. After a baby was taken from her care, she died from an overdose. It's just a complete and utter system failure. Absolutely tragic.
Okay, hearing all this can be really heavy, I know, but understanding these risks is not about creating fear. It's the exact opposite. It's about empowerment, because knowledge truly is protection. So let's shift gears and talk about what you can do. Let's look at real, actionable steps for empowering your maternity journey.
This is your maternity journey checklist. Think of it in 3 steps. Step 1. Before birth. If you have any high-risk conditions, you need to make sure you get that urgent referral to a specialist. Step 2. During labor. Understand your right to informed consent. We'll talk more about that in a sec. And remember, you can always ask for a second opinion. And Step 3. Postnatal care. This is key. You have to insist on a clear, written care plan in your discharge summary.
Okay, let's just break down informed consent, because it's so important. It's not just you nodding and saying yes to something. No way. It's your absolute right to get all the information, the risks, the benefits, and what the other options are for any treatment they're suggesting. It's all about giving you the power to make the decision that's right for you. Period.
So to make this real, here are some key questions to have in your back pocket for your care team. You can literally take a picture of this screen. Ask them, what is my postnatal care plan? Who is the specific person I should contact if I have an urgent concern? What are the red flag symptoms I personally need to watch out for? And then the most important one, can you please write this all down clearly in my discharge summary?
Seriously, that discharge summary, it is such a critical tool. You should think of it like a contract for your continued care. It's a huge recommendation from the MBR&M race report that this document must have a clear plan for your ongoing medical and mental health care. My advice, don't even think about leaving that hospital until that document is crystal clear to you. And all of this, it brings us to the bigger picture, because this is about protecting our future. This is a generational act. Advocating for yourself, for safe maternity care, it's so much bigger than just one person or one birth. It's about protecting what's to come. Because at the end of the day, informed action protects mothers, babies, and future generations. It's that simple. When you take informed action, when you ask those tough questions and you demand the care you deserve, you're not just protecting yourself and your baby right now, you're building a whole legacy of health and advocacy for all the generations that will follow you. So I want to leave you with this one big question to think about. How can we, all of us, as a community, make sure that every single journey into motherhood is safe, respected, and fully, truly supported?
Look, this conversation is far from over. In fact, this is just the beginning. We really hope you'll continue this vital journey with us. Please subscribe to Afro-Mosaic Health Guide magazine and be sure to follow along with our 52-week Global Black Lifespan journey. We've got so much more to explore together.